Hi there, I'm Dan Smith from Sports and Spinal Physio. Do you have pain at the front of your knee or around your kneecap? Does the pain make it difficult to go up and down the stairs? Do you feel pain after sitting for a long period of time with your knees bent? Or maybe you only experience pain during or after running. If you can relate to any of this, then this video is for you. Make sure you stick around to the end, as I'm going to show you how to get some extra help for this problem. Okay, so here's the problem, let me explain. At our clinic, we see many patients with knee problems, but by far the most common knee complaint we see is a condition that affects the kneecap joint, and it's called Patello pain syndrome, or sometimes also known as runner's knee. Activities such as jogging, squatting, climbing stairs can all overload and stress the knee joint, causing this pain. This can be worsened by a sudden change in how frequently or for how long you do an activity or an exercise. To make matters worse, sometimes the kneecap doesn't sit correctly on the thigh bone, and when the knee moves, this can cause pain. This type of knee problem is common, but left untreated, it can go on to be a long-standing issue, preventing you from doing things you love, and in some instances, can even lead to osteoarthritis, which is irreversible. Don't worry though, if you can relate to any or all of this, please comment me and stick around as I have some help coming your way. Here are a few things to bear in mind. Firstly, women are twice as likely to suffer with this problem compared to men. This is because a woman's pelvis is wider, and as a result the thigh bone angle from the hip to the knee is greater. This places more stress at the knee joint. Secondly, there are many studies that have shown that weaker muscles around the hip can influence how the knee moves, and this can predispose you to painful knee conditions such as this. So how can you help yourself? Well, initially you need to avoid or modify any activities that irritate your knee. Deloading the knee will help to settle things down. As your pain settles, you should aim to take a full clinical exercise rehabilitation program. Your rehabilitation program should be progressive and focus on improving muscle balance around the knee and the hip. You should aim to improve control and coordination as well as strength. Additionally, you need to ensure that you have adequate flexibility in the thigh and hip muscles. If this is sounding familiar to you and you want to get some help right now, then please click the link and we'll send you our free self-help guide. Alternatively, you can comment me below and I'll get back to you personally. I've been a physiotherapist for over 20 years and I've treated thousands of patients with this type of knee problem. Most of the patients we see with this are back to their best after a 12-week program. Now there isn't an easy quick solution, but if you put the work in and change a few habits here and there, there's no reason why this type of knee pain should limit what you do. I hope you've learned something new today from this, and I really want to help you take the next steps to being pain-free. Our Patello pain guide is exactly for people like you. It discusses more about the condition, the causes, the fix, and the steps you can take to preventing its return. In addition, there are exercises included in the guide that you can start to do straight away. If you feel someone else might benefit from this, feel free to share or tag them in this post. My name's Dan Smith. Thanks for listening. Have a great day.